to you guys the dynamic when we walk into a room, and Mayor always makes fun of me. Mayor, to this day, he makes fun of me. When I walk into a room and it's a new patient, why are you here? That's why.
Boom! Why are you here?
Good morning, I'm Dr. Suriel. Why are you here? You guys have to understand, and I'm saying you guys, the 50,000 people listening, you have to understand that that is probably the most important question
All day long
of the entire visit. And sometimes you don't get the answer to that question, why are you here, till just before you're walking out.
End.
Just before you're walking out. Well, why are you here? Because I've had this hip pain thing, and and they kind of hem and haw. And then at the very end, well, because my neighbor was just diagnosed with hip cancer. And I wanted to make sure I didn't have it. So
I'm not meaning to laugh about
No. But why are you here is really the $64,000 question.
Yes.
And in some cases, in most cases, it's pretty obvious. Why are you here? My kneecap dislocated. Yep. My kneecap dislocated. I need treatment. Why are you here? I broke my leg. Why are you here? I've got a sprained ankle. But it is so important for us to be able to focus on what is the problem at hand.
And it's not even so much why are you here, meaning like what pain do you have?
No.
I think right. It's not that.
Cerebral.
It's not that.
Yeah.
The question is really, what are you looking as a result of this visit? That's more of a, if we really hone down on what the question is, because I'll tell you, I mean, this was the conversation I had with a patient yesterday. It was a follow-up. I knew her knee hurted. I knew her knee hurt. She knew her knee hurt, but she's like, I can run, I can do all these things. So then I come back to the question, like, what's like, why are you here? What do you really want? And we came to the conclusion she was looking for an MRI so she could have peace of mind.
There you go.
But
it took a long time to get to that.
Yes. So it's not that I didn't know what she had. It's not that she didn't know she had knee pain or whatever. We had some clarity on that. Now, someone else, same issue, I'm looking for this pain to completely go away. Yes, I can run and stuff, but I'm looking for it to completely go away. It's up to us to try to figure out, to tease out, what are you looking for as a result of this visit, if that makes any sense.
Yeah, Kareem and I share a clinic on Thursdays, and sometimes we're in rooms next to each other, and he hears me, and I hear him laughing. and I'm to the point, and this is, and there's part B to this, because Kareem's a lot younger, so I want his perspective as well. There's part B to this. There are some patients that they just want to know what's wrong.
Yes.
They don't need to know it. They don't need to treat it. I just want to know what's wrong.
Yes.
Okay. Because I'll go into this, long-winded. So this is what you have, and these are the options, and they quit listening. And I'm looking at them.
They phase out.
Yep. Wait, you don't want to treat it? No, I don't want to treat it. I just want to know what's wrong.
Yep.
If you would have told me that when I walked in the door, this visit could have been like 3 minutes.
This is hilarious. But it's true.
It is true. I'm peeling the curtain back, because this is what happens when, and by the way, it's not just sports medicine or orthopedics. It's every doc. I want to know why you're coming to see me.
Yes. For some people it was like, well, I can't run anymore. I'm trying to run again. It could be that same exact issue in another patient. They're like, I just need peace of mind to figure out what it is. I'm going to keep running regardless. Right. We get in fix mode.
Right.
Because someone comes to see us, we naturally, like, you have a problem, we want to fix it. But not every patient wants fixing.
Yeah. Kareem, so how do you start the conversation?
It's so true. It really is so true. Sometimes I ask them, what are your goals of this visit? Or, in a way, I guess in a different way than what you
That's asked. A nicer way of what I just said.
Why are you here? What can I?
Why?
What are you hoping to get out of this? What are your goals? You know, that, and why are you here? It's just funny. No, but
Why the hell are you here?
But no, I agree with you. It's a million reasons. It can be as, I'm just here because I want an injection because I'm going to Europe next week. I'm here just to know, what is it? Can I make it worse? If I can't and I got to live with this, I'm good with that. Or I need a note. I need a clearance note. Or I need a note because my employer is giving me a hard time. And if I don't see a doctor and have some backing, they're pushing me around. I mean, it's 10,000 reasons, but I agree with you. If we get to the reason why, the visits are a lot faster. I could save a lot of mental, gymnastics trying to figure out why you're here.
Mental gymnastics, dude. You preach it now. Yes.
One of my favorite answers is because my wife made me. She was tired of me complaining. My wife made me come. And those people, I put them in a different category because getting better is not the reason they're there.
Nope. And here's what's crazy. Oftentimes our job is not to fix their problem, is to help them navigate what it is, like Kareem said, achieve whatever goal that they came to get out of the visit. We might be working on two different things. I'm trying to get your knee better. I'm trying to get your knee better. And you're just like, Doc, I just need a diagnosis. I may realize that what you have is really not bothering you much, but you're like, I got to get this MRI. I got to get this MRI. I got to get this MRI. And if we can get an understanding of what you want, then I can serve you better.
And I'll take it second level, why that's so important. That if it turns into a surgery, that changes surgeries. So I had a college baseball player yesterday. That kid wants to go back to playing baseball. He's got a pretty significant rotator cuff injury that in a non-thrower, a non-baseball player, you, me, Ballard, one of us, you may fix that. Well, you know what? If you fix that, that kid's not playing baseball ever again. But if you clean it up, you debride it, you do other things in surgery for the kid, he may throw baseballs again.
Yep.
And so it's a different dynamic that on what surgeries you do and what you pick based on the goal that the patient has, because it changes things.
Kareem just brought up such a fine and subtle point. And this is so important. It's a difference between a good doctor and an excellent doctor. Being able to tailor the treatment for the desires. And he's so right. Rotator cuff repairs don't do well in throwers. They just don't do. For me and you, if my rotator cuff is torn and I'm dysfunctional, fix it. Fix it.
For sure.
But if I'm an elite thrower and you fix that rotator cuff, the stats are against me. But it is such an important distinction, which is we kidded earlier. We all three of us in the room kind of got a chuckle. And when I said at the very end of the visit, I'm here because my neighbor just had hip cancer and I want to make sure I don't have that.
Right. That's
a legit reason, because if you're OCD like me and you can't sleep until you get that brain scan, I'm going to get a brain scan. And I understand the dysfunction that goes along with that anxiety. If you tell me that that's your concern, I may be able to get an x-ray and put your mind at rest right then and there.
Right. Also, and we all know this as well, whatever the patient comes in with a strong belief or perception is going to work, you either working against that or you're going to work with that. You know, some patients come in like, I'm coming because my friend got a steroid injection.
Yeah.
I need a steroid injection.
And it worked really well for him.
His friend had arthritis. He's got tendonitis.
Different thing.
And I'm trying to convince, like, you don't need a steroid injection, you know. So there are times when you gotta protect the patient, but in essence, they may be like, well, this is a bad office visit because I came to get a steroid injection. You see what I'm saying? Yeah. So their perceptions before they come in also paint how the visit's gonna go.
Oh, and I'm then next level, the elephant in the room is what insurance card or what did you bring in? Because all of a sudden, if your desires don't match with the insurance plan you chose or your employer chose for you or whatever, it turns into a nightmare on my end. Having
Nightmare,
a
dude.
quote unquote peer to peer and do all these other things, and that if you don't fit into the box of the insurance company, then good luck. Your injection may not be approved. Your MRI may not be approved. Your surgery may not even be approved. There's a whole other level of just dysfunction that then we have to deal with, part of that patient's visit.
Look, I think this last little segment, if you're new to the show, is the meat of the show.
Yeah.
This is the stuff that we do on Inside Sports Medicine that perhaps you're not going to get anywhere else in the country, because we practice Monday through Friday, hell, 7 days a week. We practice medicine, and being able to pull the curtain back just a little bit like this on a Saturday morning is the meat of this show.